Good afternoon, everybody. Welcome back to this afternoon session. How were the breakout sessions? Good. I know I learned a lot. We are going to have the designated speakers come up and present to you the topics that were discussed, the top topics discussed in each of the breakout sessions. We have a short PowerPoint presentation for each one, and we'll just go in order that they appear in your program. I would ask that you hold questions. We are going to have a panel discussion afterwards, so these folks will be up here. Whoops. Okay. These folks will be up here to answer the questions, the speakers. Wow. Okay. We have a little show going on here. Oh. Challenges, technology, right? I'm going to go ahead and introduce Dr. Kevin Sharon again. I want to actually point out a number of his titles here. Besides being the health officer for the Florida Department of Health in Orange County, he also serves as director starting back in May 22nd of 2015. He mentioned he was in Orange County for about 8 years and then left to California and returned to us. He was the Deputy Director of the Center for Chronic Disease Prevention and Health Promotion for the California Department of Public Health. And he also served as Interim Director of the Division of Disease Control for the Florida Department of Health in Tallahassee in 2013. He is immediate past chair of the American College of Preventive Medicine and currently treasurer. He received the Gold Humanism Honor Society Award in March 2016 from Florida State University College of Medicine, where he is also a clinical professor of family medicine. He presented a primary amoebic meningoencephalitis webinar to the Seminole and Orange County Medical Societies this year and authored resolutions on Naegleria to the American Medical Association and Florida Medical Association this year. And this was huge, unprecedented. So without his efforts, this would not have happened. And he co-authored a letter to the editor, as he mentioned before, of the American Family Physician on Naegleria of this year as well in April, and it's circulated so far to 186,000. So, Dr. Sharon, would you like to come up and talk to us?
So Donna pulled a fast one on me. She called me up first. I didn't agree to be the presenter. So the prerogative of the presenter is I can do whatever I want, right? And one of the things we did in our session is we judged some posters from Jones High School here in Orlando. And Mentoring in Medicine has a program with Jones High School. That is a STEM program, science, technology, engineering, and math. Students who are matriculating toward careers in health sciences, and in particular, some who are interested in professions in health and medicine. And these students became very enamored with the topic of Naegleria. And I am here to announce the winners of the poster contest. So with some technical assistance in the back, you will not first see the slides pertaining to our work group. You will see the winners of the posters. And the winners are Nose Clip. Number 2, Jump in the Lake. And number 3, Deadly Diving. Aren't those great? Come on, let's hear it. Because this session was about creating community awareness and prevention. So we hope that some of the thoughts that we share and the objectives that our work group has and the Spark room that they create with the IT platform and the communication that goes on over the next year can be robust, and we can actually accomplish some good things together. So in a big picture sense, there are really 2 major objectives and 2 major work groups. You're seeing all of the slides that these wonderful high school students created, all around the topic of Naegleria, our topic today. Isn't that amazing? I see that you're getting quite enamored in these topics yourself. Naegleria is in the area. Alliteration too, poets. And they didn't know it. Got Naegleria? Yeah. Well, we better hear the rap song too. Okay, I'm hoping that the other slides do come up. So the two major objectives were, one, the hospital systems and the health professionals, and two, the community education, which can include schools and PTAs and camps. So do we have those slides? I'm looking up here. I'm not seeing them. All right, so our work group was prevention and awareness. Next slide. And objective number one, hospital systems professional awareness. Create a statewide children's hospital consortium initiative for awareness and prevention, and correct the misdiagnosis of cases. Wow, that's a tall order, isn't it? So we believe that probably there are mislabeled cases that are now labeled as bacterial or viral meningitis, and that young people succumb to these, and that we have an opportunity to go back retrospectively and improve practice. And having that work group that starts with Florida Hospital but branches out to all children's hospitals in South Florida. There was a gentleman named Scott from South Florida, Broward, who is also here today. Objective number two is to work with our local PTAs, parent-teacher associations, to work on community awareness in schools, camps, a national proactive email blast to the national camp associations, and create a nationally identifiable symbol or logo, such as the pink ribbon for breast cancer. So anyone who wants to become a member of this work group and didn't happen to attend this morning, there should be some contact information at the end of this to join. And objective number three really falls into the public health space. That is to look at model statutes that states have already developed, that the CDC has on their website, and Dr. Cope pointed out to us this morning, that have to do with water systems, public water systems. And where states have those best practices, now begin to promulgate them to other states. And ways of doing that with National Conference of State Legislatures and other modalities. Other recommendations for neti pots, which in 2012 resulted in 2 deaths in Louisiana. Reminders on the neti pot, some sort of point of warning, point of sales warning that would take place, Consumer Product Safety Commission, those sorts of things. A black box warning, if you will, on the neti pot itself, that this could be harmful if you don't use distilled water in the proper temperatures and so forth. So proper treatment prior to use. Next slide. There isn't one, but there should be contact information, and we'll have to provide that to people. So if you're interested in this prevention and awareness work group, please check with staff at the end and say that you want to join that. But you have these 3 objectives, which I think are really cool. And you also had some really cool work done in the community by students in high school. So thank you very much.
So the next work group was early detection and treatment, and Dr. Juan Demois is going to be the presenter for that group. Just a few words about Dr. Demois. He currently holds an appointment as Affiliate Associate Professor of Pediatrics with the University of South Florida College of Medicine, and is the Clinical Practice Director for the Pediatric Infectious Disease Program at All Children's Hospital. He's also the Program Director of the weekly Pediatric Grand Rounds program at the hospital and the annual Florida Suncoast Pediatric Conference. Dr. Demois.
Thank you. Well, our group was focused on trying to optimize the earliest possible detection of a case of PAM and instituting treatment as quickly as possible. We had a lot of dynamic discussion. It was really good. And so we've sort of consolidated our initiatives to mainly 2, but I've included a 3rd one. So the first that generated the most discussion was creating a care path for diagnosis and treatment. We'd like to convene a committee of volunteers to participate. We've already got a few volunteers. Anybody who would be willing to help provide input, especially clinicians, any kind of clinician and laboratory personnel and pharmacists. There will be my email address on the last slide. Just send me an email and you'll be added to the listserv. We want to include the need for education of EMS personnel, physicians, and laboratory staff in the care path. So the care path would specifically state that this education should occur. Include an electronic medical record alert at the time of ordering CSF tests. That is what's being done now at Florida Hospital for Children. And apparently it serves as a very nice reminder for the clinicians who may know about Naegleria but not be thinking about it at that particular instance. The reminder is to ask about the freshwater exposure in any patient in whom they're ordering a spinal fluid test. We thought that was such a good idea that it should be disseminated. Disseminate a final care path to targeted children's hospitals in Florida, especially those that have the services necessary to care for these patients, including neurosurgery, critical care, and infectious diseases services. Suggestions were made as to how to word the question about water exposure in the patient. Such as, did your child play in any kind of water? Such as the example we heard about the slip and slide, that it doesn't have to have been swimming in a large body of water. Use of a neti pot, or in general, swimming in any unchlorinated fresh water. That may not be the actual wording, but that's the idea of what the content should include in the question. Objective 2. I guess I went too fast. Increase the availability of miltefosine, which, as has been mentioned, historically we had to get it from the Centers for Disease Control, but now it's commercially available. But it'd be nice if it could be stocked in all hospital pharmacies, since the manufacturer has made it easy and inexpensive for pharmacies to stock it. They don't charge the pharmacy until it's actually used. If it expires before being used, they can send it back to the manufacturer and get a fresh batch. One idea was to target all CHA, that's Children's Hospitals Association hospitals, so that's a network of children's hospitals around the country. So instead of just focusing on Florida, at least we could get the idea of contacting the pharmacy directors at all the CHA hospitals to ask them to stock it. Also, we can ask some of our own pharmacy colleagues for recommendations for networks that we can use to contact the pharmacy directors at other hospitals, especially in Florida and beyond, to start stocking miltefosine, how to stock it, what are the specifics, and I think that could facilitate it. Because very often, when a pharmacy director is asked to stock a new drug, one of the first questions is, how much is it going to cost us? And fortunately, this won't be a cost concern. Objective 3 was education, and this is sort of a compilation of different recommendations, some of which could be integrated into care paths, but there were some really good ideas I didn't want to eliminate, so I made this third slide. For laboratory staff, it could be part of the care paths that laboratory staff should get special education, maybe even as an online module. We could request assistance from our experts at the Centers for Disease Control if they might be interested in helping create an online module just for laboratory staff. And then another idea was to contact CAP, which is the College of American Pathologists. This is the organization that goes around and inspects the quality of medical laboratories around the country, so giving them specimens that they have to test and diagnose the proper problem in that specimen. And could PAM diagnosis be integrated into the inspection process? So I would start by contacting some of our pathologists and asking them, how can we contact CAP, to pose this question about including it in their inspections? For nurses, possibly include education as part of reaccreditation for their nursing license. And we had a volunteer in the audience who was going to check with the Department of Health in that regard. For physicians, recommend PAM lectures at national conventions, like the American Academy of Pediatrics convention coming up next month. About 20,000 doctors, mostly pediatricians, go to that. The Infectious Disease Society of America has the largest infectious disease conference in the nation, probably the world, and I can't think of the last time I saw that there was an amoebic encephalitis lecture there. And those large organizations have conference planning committees which accept recommendations for topics, and so I think it's easy to do. Whether they accept it or not is another thing, but we can ask them. For emergency medical services, one, it was a suggestion to have them ask about water exposure in suspected meningitis cases, and then another really interesting, good, practical suggestion was that if that's suspected, take the child to the right place. Take the child to the closest pediatric center that can properly manage a child with suspected amoebic encephalitis, because that does require some specialized services. So we'd like to pose a request for any volunteers to be on this committee to participate on the care path. My email address is listed down at the bottom, so feel free to write it down and send me an email saying that you're interested, and just say a little bit about your position or background relevant to creating this care path. I don't think we ever got around to selecting a champion who would help organize this for the rest of the year. I was selected as the spokesperson for now. Maybe since I'm the old guy, I'll be by default the person to carry it on over the next year. Any questions? Okay.
Thank you, Dr. DeMoss. And then Dr. Dennis Kyle volunteered to lead our discussion for the research session. And just a little bit more about Dr. Kyle. He is a distinguished university health professor in the Department of Global Health at the University of South Florida in Tampa. His research interests include elucidation of mechanisms of antimalarial drug resistance and discovery of new antiparasitic drugs for diverse diseases, including primary amoebic meningoencephalitis. He's also a fellow of the American Society for Tropical Medicine and Hygiene and the American Association for the Advancement of Science. So, Dr. Kyle.
When you don't show up at the meeting, you get invited to be the champion. It's my pleasure to talk about our research agenda today. We could have stayed in there for hours. It was a very energetic session. So I'll briefly go through some of the topics and be glad to answer any questions. So one of the first things we did was I gave a talk about the drug discovery effort that we have ongoing at the University of South Florida. And here's a list of some of the issues that are around the drug discovery. Basically, what we're doing is trying to implement the sort of modern drug discovery principles that have not been used previously for these organisms. All the drugs that we have that we use came from other organisms or other diseases. There's never been a dedicated effort to try to come up with something specific for these amoeba. So we're using those tools. One of them that has been very successful is phenotypic screening, where we basically put the amoeba in the culture with the compound and find out if it's effective. This is a very nice way to find drugs. In fact, it's been one of the most successful ways that people have found drugs in drug discovery. It also avoids the problem that we have. We know so little about these organisms. We don't know the biochemistry. We don't know which pathways we should target, which proteins to target. And so if you don't know those details, it's very hard to do the kind of target drug discovery. So I gave an overview of those three types. I'd be glad to go into more detail. It's on the tape if you want to see that. But we're very excited because some of our compounds right now are 2,000 times more potent than miltefosine in our laboratory testing. But can we turn those now from really active inhibitors into real drugs? That sometimes take time, but we're hopeful that we can get there, but we are excited. Next slide. The second thing is the second major objective we think for research besides coming up with new drugs is rapid diagnostics. You heard about that this morning from Dr. Ibni Ali, who's applying these tools at CDC. And as he said in his slide, one of the things that's missing is a rapid, sensitive, specific, and easy to do test that's at the patient's bedside versus sending it to CDC from anywhere in the US, or if you're somewhere else overseas, how can we get to that point? And so some of the work that he talked about that may not be easy for you to translate is his sequencing that he's talking about is going to open up new avenues that we can maybe identify specific either targets or sequences in the parasite that we might be able to identify rapid diagnostics. So we really need better diagnostics because, as you heard, the common theme is early diagnosis is one of the key things about maybe saving another kid's life. The third is, do we need a virtual research community? I think everybody quickly agreed we do. I can tell you I have not seen Francine since last year, and I do talk to Ibni periodically, but just us sitting at lunch today, we came up with 3 or 4 ideas just by sitting together and talking. So if we had this virtual community where people could exchange ideas, we could actually maybe refine what the research objectives should be. So we wholeheartedly agree with that. Next slide. Alternative treatments. This was brought up in the discussion. Is there a way that we could maybe prophylactically treat somebody? If your kid got in the water, inhaled it, is there something you could use as an intranasal spray to actually try to prevent the infection? I'm not aware of anything. We talked about alcohol-based or some other compounds that might be active, but is this in a potential area of research? It could be. Next one. Environmental testing. We talked about this. Some people, I was really enthralled with some of the discussions last night with people thinking, they hear people say, it's okay because we go in the center of the lake and ski or swim, it's safe. And I did this work 30 years ago as a PhD student. There's amoeba in the center of the lake just like there is anywhere else. And the question was asked, do we know how much amoeba are in these lakes? Is there any sort of testing going on in Florida or other areas? And to our knowledge, there's no consistent testing of this. Most of the testing has to do with going in, like in North Carolina, the Whitewater, you go in and test after a case, and yes, it's there, but does it tell you anything about how many amoeba were there? Is there a seasonality? We know there is, but is it something could be like E. coli testing where you go above certain levels and then there's an alert that this is going to be not only amoeba season, but a very bad potential season. So there's really nothing going on. This is an area I think that research should happen. Next slide. Oh, can you go back? Did we leave something out? Oh, yes. I'm glad he brought this up. He mentioned having meetings to not only community awareness of amoeba, but also the research and infectious disease communities. So earlier this year, Ibni and I put in a proposal at the American Society of Tropical Medicine and Hygiene, which is one of the 2 largest groups that meet in the US, but it's also international, a lot of infectious disease docs. And we got accepted for a symposium. I've been going to that meeting for 30 years, and I've heard maybe 3 or 4 talks on amoeba in 30 years. We're gonna have a whole symposium with Jennifer, myself, and 2 others, including Matt Lyman, who you remember from last year, trying to educate the research community as well as the infectious disease docs about what's going on. So I think awareness needs to go beyond just the community to the research and the people who treat the disease potentially. So that was it. I'll be glad to answer questions when we get to that.